Hi, everyone. My name's Nicole LaRock. I'm with Florida Health Justice Project. Today, we are going to be providing an update to our original webinar, um, Florida Nursing Home Discharges, that we offered last month, April 16th. We are joined by the wonderful Toby Edelman, Senior Policy Attorney at the Center for Medicare Advocacy, to provide some important updates that we didn't cover in our original webinar. So I am going to now pass it over to her for her to present. Thank you so much, Toby.
Sure. Thank you so much, Nicole. As Nicole said, on April 16th, we had a webinar on transfer and discharge, which is always one of the most contentious issues for residents. And my role was to describe the federal requirements. So I talked about the law, the regulations, and the informal guidance, which is Appendix PP of the State Operations Manual. That guidance tells surveyors how to conduct surveys, what to look for, how to do the survey, how to classify noncompliance that they identify. The PowerPoint described two versions of Appendix PP, a version that was issued August 8th, 2024, which was in effect, and a second revision dated November 18th, 2024, which was not in effect. The November version was initially intended to be implemented in February, but there were two delays, first to March and then to April 28th. So as of the April 16th webinar, of course, we didn't know whether the November version would actually go into effect. I had my doubts because of the two delays and because of similar delays in other Biden era guidance that we've seen in this administration. So I largely focused on the August 2024 version, although at the end of the PowerPoint, we discussed the November guidance. So the August guidance in that part of the PowerPoint, whenever I could find the similar words, similar concepts in the November guidance, those page numbers are there as well. But now the November version has gone into effect, so we wanted to talk about it at this webinar to bring people up to date. This may not be the final decision, of course. The administration has issued a request for information asking for changes that providers and others want in Medicare rules, policies, and guidance documents. I listened to a webinar on the November 2024 revisions to Appendix PP that was hosted by the trade press and featured nursing home providers. And I wanted to see if they were concerned about transfer and discharge, and they were. And the things that we consider, I would certainly consider some of the best changes in the November 2024 uh, uh, guidance document, version of Appendix PP, which increases immediate jeopardy deficiencies, the highest level of deficiencies, and which also requires strong documentation. Um, those are the things that the industry doesn't like. So the things that we think are best, they think are worst. So I'm not sure that this version will continue, but for now it's in effect, and so we want to talk about it. So next slide, please. I guess the slide after this, that has the link to the November version. Next slide. Yeah. So the main changes that we did mention in April were the consolidation of the F tags into two F tags. Just now, this is something the industry has always wanted, consolidation of F tags back to the Clinton administration, because when there are 7 F tags, each of the individual parts of transfer and discharge could be separately cited, and facilities could get cited with 4 or 5 deficiencies, all related to transfer and discharge. When there are only 2, that's the maximum number of deficiencies that a facility can get in this area, and that's what they want, fewer deficiencies. So in the November 2024 guidance, we have 2 F tags, F627, which is about inappropriate transfers and discharge, is the basis for transfer and discharge, and F628, which is the process. How did the facility do? Did it do the right thing or not? Did it give the proper notice? Did it have an appropriate location to which the resident should be discharged? The second big change was the removal of the terms facility initiated and resident initiated. That just didn't seem to work according to CMS, and it got rid of that entirely. And it reorganized and revised the guidance very significantly. And I realized that especially when I was updating the April PowerPoint to put in the discussion of the August version, the links or the page numbers for the November version. It was all over the place. It wasn't in the same order at all. Tremendous revision. So that's important to be aware of at least. Next slide, please. Other important changes, and we'll talk about this more in detail as we go through the rest of this, is that the record has to include documentation that's already in the record to support the basis for transfer and discharge. The facility can't just come up with something at the hearing and say, well, here's the basis, here's why the resident is a danger to others. It has to already have been documented, it has to be the real basis, not something that's made up afterwards. There's a lot of discussion of discharges to unsafe locations, which is a very important issue. And we talked about that actually at the end of the April webinar. And there are more examples of immediate jeopardy and harm. So CMS is taking improper discharges, transfers and discharges much more seriously than ever before. And that's important to us. So next slide, please. So there's new intent language for the first FTAG, F627, a lot of discussion about the importance of documenting in the resident's medical record of the basis for transfer and discharge. Repeated discussions of unsafe location. And on this slide, this is the new intent language. So it's red italics. When you look at the November 2024 guidance, you'll see that all the changes are included in red italics. The problem is what they delete, you don't see any record of that, but the new language is very clearly here. So this language, two important points, that the facility must allow the resident to return to the nursing home after hospitalization or therapeutic leave. The facility generally has to allow the resident to return and then go through the entire notice and hearing process if it wants to discharge the resident. So CMS clarifies much more that facilities just can't use self-help and get a resident out by sending the resident to the hospital and then saying, well, no, you can't come back. They can't do that. This is clarified in this November version. The second big point is that CMS stresses that facilities can't transfer or discharge residents in an unsafe manner or to an unsafe location. The new facility has to be able to meet the residents' needs and preferences. This is a very, very important point. Next slide, please. CMS also requires the coordinator of the survey team to contact the local ombudsman before the survey to ask if the ombudsman is aware of any complaints from residents about inappropriate discharge. The team coordinator before the survey must also review complaints and the survey history to see if there have been any indications of noncompliance with transfer and discharge requirements. Notice, though, that the surveyors only look at complaints and survey history. They do not try to find out if residents had filed an administrative appeal and whether there was a hearing and what the result of the hearing was. That is not part of the survey process. So our guidance has always been, our recommendation is if a resident is appealing a discharge notice, also file a complaint with the state so that the state has a record and it will be considered part of the record that surveyors look at. Next slide, please. This is guidance for 627. Surveyors must determine whether the facility has documented that the basis for transfer or discharge was actually met. Facility cannot come up with the evidence at the hearing. The required documentation must already be in the record. The next three slides, 8 through 10, explain that there must be evidence in the record that the resident was a danger to self or others. Maybe we can go to the next slide, please, and you'll see what the language says. The first bullet that they have, if the facility is saying they can't meet the resident's needs, there has to be evidence that there was an assessment when the facility was trying to discharge the resident, which specific needs can't be met. Can't just say, "Oh, we can't meet your needs. We can't meet your needs." They've got to say, we want to discharge you because this is the specific need you have that we are unable to, to meet. Um, the second example, the second about the facility services are no longer needed by the resident. Well, if the documentation shows that the resident's health actually did not improve or actually declined, then this facility can't be saying, you no longer need meet the service needs that we could provide. It just they can't just come up with this example at the last minute. So uh, slide 9 is another example of this, of what they're saying, evidence that does not support the need. If they're saying the facility is saying the basis is that the resident is endangering the health or safety of other people in the facility, there needs to be some documentation in the record that supports that claim. If there is no evidence in the record that supports the claim, then that basis has not been met. And if there's a failure to pay basis, which is a legitimate basis, uh, there has to be evidence in the record that if the resident, say Medicare, was ending, that the facility said to the resident, well, you can apply, you can pay privately, or you can apply for Medicaid, and we can help you apply for Medicaid. They have to show that in the record. They can't just say non-payment. They've got to show that they've offered the resident other ways of paying for the stay. Slide 10, please. This is about appealing. If the resident is appealing the discharge, then the facility can't just discharge the resident. They have to allow the resident to go through the entire appeals process. Now, there is an exception if the resident endangers the health or safety of individuals, but there has to be documentation again. So this is a very interesting expansion on what we've known before in the rules, but the new guidance makes it very, very clear that there has to be strong documentation existing in the record, not made up at the time of the hearing. Next slide, please. This is extremely important, and we discussed this at the end of the last webinar last month about this. But we're very concerned about facilities discharging residents to family members. CMS says now in the guidance, there has to be evidence that the facility considered whether the caregiver had was available and was capable and willing to perform needed care for the resident following discharge. So we know that facilities try all the time to send residents to their adult children without determining that the children are able and willing and have the capacity to take on the responsibility of caring for their parent. CMS says the facility has to do that. They can't just say, you're going to your daughter, good luck. Next slide, please. As I mentioned, and this is in slide 12, it's important to file a complaint with the state because the survey agency does not consider hearing decisions when it decides whether a facility is in compliance with transfer and discharge rights. So the state survey agency must conduct a survey to decide whether there is non-compliance. So if we want to have a deficiency, we need a complaint as well as an administrative appeal. Next slide, please. If the facility is proposing to discharge a resident to an unsafe environment, the plan of correction must require that the resident be readmitted to the facility or coordinate the transfer of the resident to another setting where the resident will be safe. So that sort of hedges on the first part. I mean, we want a strong plan of correction, preferably readmission of the resident. CMS does give them this out if they can find another setting where the resident will be safe. But this is important that the plan of correction address unsafe discharge if that's what CMS is citing. If the survey agency says it's an unsafe environment, then the facility's plan of correction has to be pretty specific about what it will do. Next slide, please. If the location for discharge doesn't meet the resident's health or safety needs, then, and this is pretty unusual, CMS says enforcement has to begin immediately. For example, there could be a discretionary denial of payment for new admissions, which would go into effect pretty quickly and remain in effect until the facility returns to substantial compliance. So that kind of deficiency really requires enforcement. We're not going to delay this indefinitely while they horse around. We're going to require a plan of correction to take the resident back and have a penalty going into place pretty quickly. Important change. Next slide, please. CMS also makes clear that when they're determining the psychosocial outcome of a deficiency, they need to use, for transfer and discharge, a reasonable person approach. They're not to look solely at what the specific resident says or how the resident responds to an inappropriate location. The question is, how would a reasonable person feel under these circumstances? Again, this is strengthening the rules to say, look, maybe Mrs. Smith didn't really know she was being moved and was confused, but a reasonable person under these circumstances would object. It becomes a psychosocial harm to that resident. Next slide, please. So immediate jeopardy, as we know, is the highest level of deficiency. Immediate jeopardy and harm, level 3, are the two levels where most enforcement occurs. So unless something is considered serious by CMS, there's usually not any enforcement penalty. The civil money penalties are imposed for jeopardy and harm, typically. Although if there are 20 no harm deficiencies, there can be a penalty, but usually they're limited. So CMS is beefing up the definition or the examples of immediate jeopardy deficiency. And you'll see in the red italics what they say, really stressing this, that sending a resident to an unsafe setting that can't support that resident's needs is immediate jeopardy. So this is the first time we've seen unsafe setting as an immediate jeopardy deficiency. And this is why the facilities in that webinar I listened to last week were very concerned about this. They were worried about the increase in immediate jeopardy, and they were worried about these unsafe discharges or unsafe settings. They thought that really was going to subject them to more trouble, more deficiencies, more higher level deficiencies. Next slide, please. The actual harm level deficiency includes new language as well. So if the facility says it can't meet the resident's needs when they refuse to allow the resident to return from the acute care hospital, surveyors are told that they are to look at the resident's records and to see if there are any new needs after hospitalization that the facility cannot meet. They can't just say we can't meet your needs. They can't just make this blanket statement. They have to have evidence, and the surveyor has to look for that. They have to look for it. So if the facility doesn't want the resident to return after being in the hospital, they've got to show which specific needs at that point they are unable to meet. Next slide, please. This is not new language, but I want to stress it because it's really important. This is an actual harm deficiency. If the resident's Medicare coverage ends, assuming it's ending legitimately, and the Medicaid application is pending, if the facility discharged the resident to a new facility that's far away so that the family can't visit, and the resident got very upset and withdrew from social activities, that is harm. That is harm. They can't just move people around. They're certainly not supposed to move people when the Medicaid application is pending. That is not non-payment. CMS has said that for quite a while, but it does happen. And so CMS is saying that is actual harm. Next slide, please. So for F628, the process, there is new intent language here. So this is important language. The facility is required to follow all the components of the process for transferring or discharging a resident. That means documentation, information sent to the receiving facility, actual notice of the transfer and discharge, notice of bed hold policy, and a discharge summary. All of that is included in F628. Important new intent language. Next slide, please. So language is added to immediate jeopardy for this, for F628. And it says if a facility does, as an example, does not tell the receiving facility that the resident they were transferring there was on blood thinning medication and the receiving facility didn't administer blood thinning medication, then that's immediate jeopardy on this facility for the discharge. Not supposed to do that. And there's good language. So I think that is the last slide. I just want to say I think that there is good language in the November 2024 revisions that advocates can effectively use to challenge proposed transfers and discharges. And I hope the surveyors will also take transfer and discharge more seriously with this new revision, cite higher levels of deficiency, and really hold facilities' feet to the fire that they are only discharging residents whose needs they really can't meet, who are really a danger to others, although why is another facility more acceptable? But I think the point is there's good language here, and we should try to use it and enforce it to the extent possible. So, Nicole, thank you very much. That's what I wanted to say today about the new guidance.
Thank you so much, Toby. That was a really informative and important update. And I just wanted to thank you for taking the time to discuss this with us. And I wanted to also remind everyone that the original webinar recording is available on the Florida Health Justice Project's website, along with slides for both that include all of the materials that Toby just went over, as well as the original webinar recording slides. And we also have some wonderful resources that talk further about nursing home discharges that are specific to Florida. So those can be some helpful resources for advocates. And those are all included on our website, and this recording will be shared there as well. So thank you all for watching, and thank you again, Toby, for taking the time to do this.
Sure, my pleasure. Thanks so much, Nicole.